रिंकल मैडम તમે સ્ટાર્ટ કરો.
Okay, sir. A very good afternoon to all. I, Dr. Rinkal Parmar, working as an assistant professor at Ahmedabad Physiotherapy College, Parul University, welcomes you. And on behalf of Parul University, I would like to invite our today's guest speaker, Dr. Dhruv Dave, sir. He is working as an associate professor in the Ashok and Rita Patel Institute of Physiotherapy, Changa, Anand, and he has finished his PhD under the guidance of Dr. Ali Irani sir at the Charuset University in the June 2020. He has organized more than 300 community physiotherapy camps in and around 100 villages of Changa to create the awareness about the physiotherapy treatment into the society. He is trained for the skill enhancement of the Mulligan concept by the Dr. Deepak Kumar sir, and he has conducted workshop on the tapping techniques for the musculoskeletal disorders and the myofascial pain relief syndrome. He has guided 16 research studies for the MPT students and the 40 research studies for the BPT students till date. He has presented many research papers in the national, even in the international journals. And he has also taken lectures for the students of Penn State University of United States of America in the collaboration with the Charuset University for the Health and Physical Activity course. Now, I would like to request Dr. Dhruv Dave, sir, to start with the session. Thank you.
Thank you, ma'am. Is my screen visible?
Yes, sir.
Okay. Today's our talk is on physiotherapy and lifestyle disease. And prior to starting the talk, I would like to thank Almighty my parents, my wife, my daughter, and the management of Charuset as well as Parul University. I also would like to bow down to my teachers, those who have given their knowledge, skill, and expertise to me, which I can impart in others. I also would like to thank my fellow colleagues and students of Charuset, those who have always put faith in me, and because of them, whatever I am in a position to achieve today. Needless to say that thanks to Rinkal madam as well as principal sir of Ahmedabad Physiotherapy College, Bhopal, for providing me the opportunity for this particular session on physiotherapy and lifestyle disease. Prior to starting, I just would like to disclaim that whatever the points that has been covered are on the case-by-case basis, and one need to take the things into consideration prior to putting it into the practice. What we are going to cover today is about what are the various lifestyle diseases, and then for each of the lifestyle disease, what sort of things we are in a position to do. To begin with, on a lighter note, as the lifestyle that has changed, the war as of now is going on in between Russia and Ukraine, but otherwise, because of the change in lifestyle, because of the sedentary behavior, sitting practice, and so on, things are going on, and that's the reason why we have a mother, maternal uncle, and maternal aunt along with us. I mean by that, in our surroundings, people are suffering from either hypertension or diabetes or obesity, or either 2 or 3 of them, and because of that, many other consequences are what is happening. The key factors which are necessary to have the healthy lifestyle are: one, need to take care about dietary habits and the sleeping patterns. The one who has good dietary habits and good sleeping pattern, and along with that, the exercise habits, are able to live not only just longer, but good quality of life, the healthier life. Along with that, one need to take about the recreation as an important aspect. Why? Because the stress is what is part and parcel of life. And if we are not doing enough recreations, then the stress is ultimately affecting us. Application of modern technology and its optimum usage is very much necessary as a part of healthy lifestyle. And one need to take care about the usage of medication as well as the substance abuse. So the main point is which are the various lifestyle diseases. These are the lifestyle diseases because of the day-to-day habits of the people surrounded by us. Basically, it is because of the sedentary routine, because of the kind of activities one is doing, because of the kind of sitting behavior one is going for, and because of that, gradually and steadily, the chronic non-communicable disease are what is increasing in the individuals day by day, month by month, and year by year. Here I would like to make you know that when we were studying, we have been taught by our teachers about the non-communicable disease, and those were the days where in 60s the hypertension or diabetes are ultimately affecting the individuals, and the individual is affected by cardiovascular disease and many other ailments. As soon as we have come out and started doing our academic practice, the things have changed and moved one decade ahead. That's in the 50s. Now, if we are looking in our surroundings, it even happens in the early 30s of the individuals. And that is where the change in the lifestyle disease. Along with that, the metabolic disease, the joints and bones problems, violence, and many other unhealthy lifestyle are also affecting the individuals. And this includes the issues with that of the hormonal imbalance like PCOS, thyroid issues, menopause and andropause issues. And along with that, the issues those are affecting as in the psychological health, the mental health issues. And the mental health issues, especially post-COVID-19, has increased a lot because of the not only just the physical ailment, but the financial ailment as well. So, as what I have mentioned, it's about the obesity or heart disease or diabetes, even depression and cancer and stroke, as well as arthritis and lung disease are the part and parcel of the lifestyle disease. And we will go into the detail of each of them. Now, if we look at the numbers being given by WHO in terms of the mortality rate, the mortality rate for various diseases, especially the top 10 causes, are hereby shown in the graph, where the number one leading cause is what is the ischemic heart disease, followed by stroke and chronic pulmonary disease. What significantly you can see into this is, as these data are of 2019, the respiratory infection and the neonatal infection, as well as the GI tract disturbances, because of the invention of antibiotics and the pharmacological advancement, their possibilities of over getting control has improvised upon. So if we look at 4, 5, and 8, those are the communicable diseases, but are able to be controlled compared to 2 decades before. While that for the other diseases, as those are associated with non-communicable and the lifestyle disease, their mortality rate has increased and has produced millions of deaths worldwide. The problem that happens with the Indian context and Indian data is the 3 major problem. Number 1 is the population is so diversified, along with the different social and cultural characteristics, and many of them has still the lack or inadequacy of the access to those healthcare institutions, as many of them are located in the rural communities, and that's the reason why universities like yours and mine are working at rural setup to improvise upon the need of the healthcare for the left out individuals. Along with that, the indigenous healthcare system and relying on those indigenous healthcare system have been so many-folded, and that's the reason why the data in terms of Indian context are many a times lacking. This is a sort of small cartoon through which I want to show you that it's very easy to be seated, right, in the zone of comfort and drinking cola, and because of that it affects not only your insulin secretion but the resistance to insulin, and along with that obesity and many other factors that affects. Now, talking about first lifestyle disease, that's the one which is coming across the globe. And if we are specifically talking about Southeast Asian and Indian context, so it is increasing and increasing exponentially. This is a kind of diabetic map I have shown for the prevalence of diabetes according to International Diabetes Federation. The similar one, if we are talking about Indian context, so 1 in 11 adult is suffering from diabetes. That's worldwide. If we are talking about Southeast Asian, 1 in 5 suffering from diabetes is coming from Southeast Asia. And everyone in the 6 adult that suffers from diabetes is of Indian origin. The major problem that happens with diabetes is that it remains undiagnosed for years together. And as it remains undiagnosed for years together, it not only affects the eyes or kidneys or lungs, heart, brain, your small vessels, your foot, neuropathy, nephropathy, and likewise. And by the time one realizes it is too late and one need to go for amputation. What are the risk factors for diabetes? As you and me, we know that we ask most of our patients when they come, do they have their history of diabetes, which is what is non-modifiable risk factors. But if they are talking about their BMI, then that is the one which is what is modifiable as a risk factor. Same way about the inactivity in relation to lifestyle or having the blood pressure readings on the higher sides are always possible to be modified one. Same way, the dietary habits, the abnormal blood cholesterol or the lipid profile are possible to be modified one. If history of gestational diabetes or age above 40, which are again the factors but are the non-modifiable risk factors. Now, when it comes to diabetes and working very closely with diabetic patients, one of the major point of concern here is about the diagnostic criteria. And why I am emphasizing over for diagnostic criteria is because most of our patients, they cheat for the diagnostic criteria. I mean by that, when the blood sugar testing is being done, many of them, they do fast or control their dietary habits very well, and that is the reason why their fasting plasma glucose level comes in controlled age group, and that is the reason why it would be very difficult for them to catch at an early stage. If we are talking about the ICMR guidelines, the ICMR guidelines suggest as what the table shows of fasting plasma glucose below 125 is appropriate, into that of postprandial 2 over after glucose is unsatisfactory if it is above 180. Along with that, the blood pressure and the BMI is the point of concern for us. And ideally, that is the reason why one need to go for and target the 3 months average blood sugar, which is what is A1C readings. Is expected to have below 6.5, but if it is less than 7, that is also considered good. When we are talking about management, the management is in terms of diet and the lifestyle modification, about doing exercise, about taking enough and appropriate and timely medication, which is what is necessary for the glycemic control. Along with that, if they do have any associated illness, like as what I have said, that Ma, Masi, and Mama, all these three goes together whenever they are going up. So one need not only just to take care and control over sugar, but also need to take control over their blood pressure, over their lipid profile, and over their weight in totality, so as to prevent the issues with that of stroke, to the issues of that of coronary heart disease, and many other things. Along with that, it is necessary that if someone who is catching them at an early stage, then it would be possible to control the microangiopathy, which ultimately affects and cause retinopathy, nephropathy, and neuropathy, which ultimately converted into diabetic ulcer, diabetic foot, and then ultimately amputation. Now, this is where ours is important aspect, because at the end we want and need to know about the prescription, and that exercise prescription is very much necessary and the in thing for the patients as well as for other team members of healthcare, so that they can know what your capacity is and how precisely you are in a position to control sugar levels and delay the secondary complications which are what bound to happen along with diabetes. So in that, as you know, the aerobic exercise and the resisted exercise are part of concern. So when we are talking about any sort of exercise, it is very much necessary that we need to know about that for each of them, what sort of exercise type one can use. It could be either high intensity interval training, HIIT, or prolonged rhythmic activities targeting the large group of muscles. That may be either cycling or swimming or walking or treadmill, so on and so forth, with the intensity of moderate to vigorous, and the duration of exercise which is necessary according to ACSM as well as the WHO guidelines is need to be between 90 to 150 minutes per week, and that needs to be done at least every alternate day to all days a week, right? And one of the important aspect, which is what is one should not have off of more than 2 consecutive days, right? And then gradually the progression is which is what is necessary, which is depending on uh, the various vital parameters, and accordingly one can progress for the aerobic component. Similarly, various researches are going on and have proved upon its importance in relation to resistance exercise. And for that, the free weights as well as TheraBand, TheraTubes, and multi-gym machines, the resistance muscles, are helpful in a set of 6 to 8 repetitions with moderate to vigorous amount of weight, where again one may target about each of the large group of muscles, may it be of upper extremity or lower extremity as well as trunk. And this also is preferable to be done at least 3 days per week. One may start with the resistance exercise of repetition of 6 to 8 with 1 set, and then can gradually increase upon as one may progress. So that's about aerobic and resistance. The third important aspect as per the ACSM guidelines is about the flexibility as well as the balance training. And one needed to take about stretching as well as the balance training so as to improvise upon and reducing the fall prevention strategies. And for that, the flexibility need to be 2 to 3 days per week, as well as balance that need to be 2 to 3 days per week, which is targeting the core muscles, and gradually one can improvise upon for flexibility as well as the balance. What are the various benefits which can improvise help in terms of insulin sensitivity? So that is going to improve because of doing the exercise, and the glucose uptake inside the body is going to be, and that will help in lowering the blood sugar level. That also will help in lowering the blood pressure as well as the cholesterol level. That helps in controlling the weight, and all ultimately are in a position to help in reducing the risk of developing secondary complications, maybe neuropathy, diabetic foot, so on and so forth. So along with exercise, and we have mentioned about the benefits of exercise, it is very much necessary that we need to give them sort of care program. So what sort of home advice or patient care program or a sort of leaflet, which I will show for one of the lifestyle diseases which we have developed and are routinely prescribing to our clients. So in relation to when someone is talking about diabetes, it's very much necessary that one need to take about diet, one need to take about allied healthcare, one need to take about exercise. Yoga is one of the form of way where one can use it. Sleep, which is very much necessary, because if someone is not sleeping, can induce stress, and then stress induced increase in sugar level may come into picture. Right? Now from sugar to that of pressure we are moving upon, and when we are talking about hypertension, one need to follow the James 7 guidelines. And as you know, if the individual is 140 plus or 90 plus in the stage of 1, 2, and 3 of hypertension, and even the crisis as well. But one may need and start working at pre-hypertension level. So if they work, then it would be very easy to not to have them enter into stage 1 hypertension. Again, if we are talking about worldwide data, 20% of the adults of the world are suffering from hypertension, and the numbers are increasing, and they are ultimately contributory to the mortality, millions of deaths across every year. And here in this graph, I'd like to show that in the developed countries, the way the growth of the hypertensive individual is quite controlled, and that has been 2.5 times folded increase if we are talking about developing countries, from 639 million to that of 1.15 billion over a period of 25 years is going to be. And you can see here where are we standing as in India for the hypertension. In age-wise distribution, every now and then in our OPDs, we are getting the patients who are at a very early age, suffered from stroke or cardiovascular disease, and because of that they have to ultimately join the exercise program. And in this, till the age of menopause, males have their higher and upper hands so far as concerned with hypertension. But as the age advances, the female surpass that of males. And as again I am saying, hypertension and obesity, they go hand in hand, and as the weight increases, the prevalence of the individual being suffered from hypertension again increases to that of 2.5 times. Talking about urban to rural, the myths that's existing is that the rural people, because they live in rural setup, have fresh air, doing a lot of hard work, farm work, and likewise doesn't suffer from. But the data's quite eye-opening and quite surprising. And when we have done about the awareness session, the awareness so far as concerned hypertension is almost half to that of the urban population. This is one of the important graphs to show it to all of you is about the study that has been done and have come out with the results of various states of India, and the way the hypertension, which is what is newly diagnosed, and the individuals who are in pre-hypertension, almost similar to that of the one who are known with that of their hypertension. So the results are quite surprising. And, we are one of the developed state, and as we are developed, we are great way suffering from the lifestyle disease, including hypertension. Talking about risk factors of high blood pressure, age, one of the major factors, and the congenital health problems, which are what almost non-modifiable risk factors. But smoking, salt intake, alcohol consumption, stress level, and the one and important aspect is the inactive lifestyle. And because of that, it causes increase in sugar and that also creates obesity. So these risk factors are able to be modifiable, able to be controlled, and if one controls, can overcome this particular aspect, which is what is hypertension. So for prevention, using salt intake, increase amount of fruit and vegetables. One need to be physically more active. Avoid using tobacco either in form of cigarettes or any sort of alcohol consumption reduction, which is to be considered as a part of social things. Limiting the intake of food, especially of the high in saturated fats, and reducing trans fat in that help the individual for prevention of hypertension. This particular algorithm is helpful in deciding the individual to go for whether to go for type A exercise, type B exercise, or type C exercise. If the individual is suffering from pre-hypertension, and the next question that comes is about the various questions which are needed to be asked for in relation to cardiovascular disease and whether the individual is suspected by those cardiovascular disease. And if the answer comes yes, then one need to go for the protocol C in relation to exercise. If the individual does not suspect to have cardiovascular disease with more than 50 years of age, then the individual should go for the B protocol of exercise, as we will go into the next thing. And the individual who does not have any suspicion towards cardiovascular disease, or they have their age less than 50 years, but still also they need to do exercise and exercise prescription with that of type A. Now, if the individual who are having hypertension, either of grade 1 or of grade 2, then immediately the next aspect is what is we need to screen about for cardiovascular disease. And for cardiovascular disease, again, they need to be tabulated in either A or B or C, depend on the algorithm. So moving to the ACSM guidelines about what one should have when someone is going for any sort of exercise. So one need to do the aerobic exercise in form of walking, jogging, cycling, swimming. And in terms of resistance exercise, one need to target the muscle mass. When someone is in group A, column A, the monitoring is what is not necessary, but as what the newer gadgets are available, and now the blood pressure, pulse rate monitoring, and SpO2 monitoring, as well as monitoring of respiratory rate and many other things would be possible. So one can use those gadgets and can do the exercise and improvise upon and get the reversal in the prehypertensive state. In column B, the individuals those fall either with prehypertensive with cardiovascular disease or hypertensive with cardiovascular disease, or prehypertensive with no more than 50 years of age and cardiovascular disease absence. They need to do walking and cycling, right, until they are medically evaluated and then ultimately prescribed by the expertise like you and me. Monitoring, which is very much necessary, especially because of for their sedentary lifestyle, and many of them, they had the problems in relation to adherence to exercise. As you know, many of us, we start doing exercise with a greater amount of zeal, but as the time advances, we gradually start coming out with a lot of excuses as barriers to do exercise. Those may be in relation to lack of time, lack of social support, lack of family support, to that of bad weather, to that of kind of support that's what is available from friends and family and likewise. So one need to overcome that to improvise the adherence to exercise. So for them, those are to be monitored even in relation to their sedentary lifestyle. For column C, the individuals, those who are hypertensive, cardiovascular disease, the low impact activity like walking, cycling, and they needed to be monitored routinely for their cardiac as well as pulmonary rehabilitation, so that the aerobic training, which would be helpful and can get important results with periodic monitoring. Right? So resistance exercise as well as that of the aerobic exercise could be necessary, either need not be monitored, could be monitored or frequently monitored and divided according to what their labels are. Moving to next, lifestyle disease. It's about atherosclerosis, the plaque that's being formed because of hyperlipidemia, dyslipidemia, because of the love towards pizzas and burgers and all sorts of tasty food, ultimately causing atherosclerosis, and that ultimately affect the tunica intima. The lipid is what is ultimately affecting and injuring the innermost layer of the arteries and causing inflammatory reactions, and that's how it affects major arteries like femoral or renal, even in case of carotid as well as cerebral artery. One of the point of concern in relation to outcome measures for them is the ankle brachial index, and which is what uh, routinely being used in terms of uh, the pressure of ankle mean by dorsalis pedis to that of posterior tibial and divided by to that of the pressure that has been exerted into the brachial artery. And the index that comes will ultimately suggest that what sort of arterial disease it is, whether the vessels become completely calcified or the sort of moderate to severe arterial disease, and one need to consult the vascular specialist and can go for exercise. This vascular rehabilitation is very important, which ultimately help the individual to overcome functions and functional training. And along with that, the strength training is necessary. Point on the lighter side, which is what that जिंदगीनी भागदौड़માં બધા પાછળ રહી ગયા, ખાલી એકમાત્ર પેટ. That comes to talk about obesity, the excessive accumulation of body fat, and overweight and obese that causes the issues with that of cardiovascular disease, diabetes, and obesity is also causing and making the individual to be affected by various forms of cancers, musculoskeletal problems like bones and joint disease, and so on and so forth. So BMI is one of the outcome measure that is being used, and when we are talking about Asian context, we need to take into consideration on the lower side because of the kind of Asian strata different compared to that of the Western population. Waist hip ratio, that is the ratio of the abdominal girth to that of the hip girth. That's where if it is more than 1/4 and more than 8 for female, is ultimately indicating pathological issues and increased risk for cardiovascular disease, diabetes, so on and so forth. Skin fold thickness measurement is another outcome measure where various sites the skin fold measurement is being done. If the individual has time, then can get the 7 sides skin fold thickness measurement, triceps, pectoral region, mid-axillary, subscapular, suprailiac, abdominal, and thigh. But if the schedule is too busy or only to check 3 skin fold sites, and for male it would be chest, abdomen, and thigh, and for female it would be triceps, suprailiac, and thigh, which is to be considered. Now again, for the exercise plan for obesity, the moderate intensity one need to start with heart rate reserve of 40 to 60%, and then gradually progressing beyond 60% heart rate reserve. For obese individual, 20 to 30 minutes, at least 30 minutes per day exercise, which ultimately converted to 60 minutes per day of exercise for 5 days a week is a sort of recommendation. And aerobic resistance and flexibility exercise are the type of exercise one should target for when targeting the individual with obese, where one may be targeting the torso along with upper extremity on one day and lower extremity on another day, and along with that sort of session for aerobic exercise. Moving on to cancer as a sort of lifestyle disease. Various regions, especially the Asia, if we are talking about the global cancer data of 2018, about half of the individuals suffer from cancer are from Asia, as per the data from WHO. And the various causes, which are what causing cancer, could be tobacco, physical inactivity, overweight, UV radiation, low intake of fruit and vegetables, hormone replacement therapy, low vitamin D, so on and so forth. And that's where one need to target about those modifiable risk factors, about being out to have the sun rays, about taking care about the weight and the dietary habits, as well as the cessation of smoking and the alcoholism. Right? Yeah. This is what I was talking about, that when the individual is to undergo surgery, then after need to be trained for the exercise program. The first week after surgery, what sort of exercise, which are what being done and shown down over here in relation to relaxation, which are to be very much necessary, and then ultimately targeting shoulders, which are what mutually bound to be affected, especially in case of radical or modified radical mastectomy cases. Once the first week after surgery, the exercise which is to be done is about 10 to 15 minutes, but its frequency is what is more. The frequency, which is what is 4 times per day. So it is very much necessary to get used to have a sort of loss from the body. But as soon as the drains are removed, the dosimetry can be increased upon in terms of increase in repetition and targeting the major as well as the group of muscles. Start doing the functional training, which would be helpful in overcoming the secondary complications which are what bound to happen after mastectomy, and the progressive muscle relaxation, especially from trunk to that of hands, arms, and shoulder. This one is what is talking about the sort of exercise prescription, the leaflet, which is what to be given to the patients after surgery, that what sort of exercise one should do, how one should do, especially naturally in the first week under the supervision of physiotherapist in the hospital, and then once the patient gets discharged at home, what sort of exercise which is what to do. Now, moving towards few points, those are remaining in relation to lifestyle disease. One, which is what is the psychological issues. And if we are looking at the newspapers or in our surroundings, the print and social media which are not going on, the psychological issues are increased. And the depression and anxiety are the most common condition that's affected in the individuals. If we are talking about the depression and anxiety as an issue, and the impact of physical activity associated with will help in reducing the anxiety, reducing the depression, improvising the well-being, improvising the change in mood. Physical inactivity is ultimately associated with the development of all sorts of psychological issues, and that is the reason why one need to come out and do some form of physical activity and exercise. It is necessary to know about the impact of the various form of exercise one do, and the outcome measures are necessary. And for the similar reason, for psychological issues, the outcome measures like the depression inventory as well as geriatric depression scale, short form 15, is to be used. And for the prescription, the addition is what is the various form of yoga, and this could be the chair yoga or standing yoga or sitting yoga, and the progressive muscle relaxation that would be helpful in changing the mood, and those are ultimately helping for overcoming the depression and overcoming the anxiety. Last but not least is about the hormonal imbalance, and that is the reason why one need to check about the various hormonal levels, and as what I have mentioned earlier is about menopause, and the PCOS is one of the major lifestyle issues one need to take care about. And PCOS again is an issue about infertility, about menstrual problem, about hirsutism, so about weight gain, and likewise. And for that, cognitive behavioral therapy, mindfulness, dietary intake changes, stress reduction therapy, light therapy in relation to acupressure and puncture would be great help. Right? So in nutshell, I would like to recommend you two of the books which are what principles and practice of physical rehabilitation and physiotherapy in general medical and surgical condition, from which I had taken majority of concern for getting change into our lifestyle disease, and that is what is recommended for you. These are the references for this session.
Okay.
Yes, ma'am.
Yeah, okay. Thank you, sir. Thank you very much for sharing such a valuable information with our students and with us. Thank you once again on behalf of whole Parul University. Thank you, sir.
Thank you very much.
Okay, sir.